This morning for our panel on social media, an opportunity for chronic disease prevention. The future is now. This morning, our panelists have a very engaging and exciting presentation for you. We're going to share initially some current research findings and the evidence base for social media, some practical examples of the application of social media in public health programs, and how the integration of social media can be used in our public health work to maximize the uptake and exchange of public health information. So I'm going to begin by giving a very brief bio for each of our panelists, and then we'll get on with our presentations. I do want to ask, though, if you could, please put your BlackBerries on quiet or vibrate. That would be great, even though this is a social media session. We would like that for the courtesy of our speakers and for our participants. So I'd like to begin by introducing Jennifer. Dr. Jennifer Keelan is an assistant professor at the Dalalana School of Public Health, University of Toronto. She holds an Ontario Ministry of Health and Long-Term Care Career Scientist Award. Her research areas include Canadian public health policy, public deliberation, and citizen engagement and health communication using social media. Jennifer, welcome. I think I'll do all the bios and then if that's okay. Sitting to Jennifer's right is Alex Langshur, and Alex is founder and CEO of Public IsaiX, a Boston and Ottawa-based web analytics, optimization, and marketing consulting firm. Alex established Public IsaiX because he saw a tremendous need for a bridge between those who manage online data within organizations and those for whom the insights arising from the data have the most value. Alex is passionate about helping clients understand the meaning and business value within the numbers and optimizing the connection between each client's unique vision and needs and the online behavior and desires of its most important stakeholders. Alex is a sought-after speaker and is the past president of the Web Analytics Association. He teaches highly rated courses on web analytics for University of British Columbia, GSA Web Manager University, and WAA Basecamp, and has been frequently published in journals and magazines. Alex lives in Boston with his wife, 2 sons, and a golden retriever. My favorite dog. I already told that to Alex. I grew up with a golden retriever, several of them. Our final speaker is Steve Gregory on our far right. Steve is the founder and CEO of IsaiX, an application service provider and consulting firm specializing in performance management and coaching tools for Fortune 500 companies. Over the past 20 years, Steve has built a client list which includes 160 prominent international firms such as TD Canada Trust, Pfizer, Vancouver General Hospital, Merck, Michelin, Bombardier, Danone, Manulife, and the Public Health Agency of Canada. In 2006, Growth at TD Canada Trust won IsaiX their Business Partner of the Year award, and in 2008, Steve was voted Speaker of the Year in Canada for TEC, Canada's Association of Chief Executives. Steve and his family, wife, his daughter, and son live in Montreal. Steve plays golf whenever he can, but I don't think that's very often, Steve, because you're very busy. Enjoys times with family and friends, and his family apparently will attest to his love of cooking. Great, so welcome to our panelists. Steve, I'm going to call on you, I think initially, to explain a little bit about the technology we're going to be using this morning before, is that okay?
Thank you. Ladies and gentlemen, you'll notice on the seats, either the one you sat on or the one next to you, there is a remote control. Now, there should be enough for both the men and the women in this group. You'll notice that it is not television controlled. It's going to be used as the audience response system. So throughout our presentations, we've sort of laced in a number of questions, and we hope to engage you using that method. There is also, if I may, I'm just going to, if you could turn the slide forward for me. Tim, do you want to advance for me? There's a wireless connection in this room, and we've had a little bit of trouble this morning. This room just doesn't seem to like technology, so it's fading in and out, but we hope that you can make use of it. If you want, you can connect to it. And did you want to tell them about the hashtag?
Right. You may or may not know this, but we are doing a session on social media. Therefore, there is a social media hashtag for Twitter, which is hashtag CPHA. So if you want to, during the course of the session, tweet what we're talking about, that'd be great.
So just a final note on those channel changers. When the question comes up, we will tell you that, of course, it's going to be a voting question. And you just pick the number that is associated with the question you want. You have to wait until the music starts. All right, that's the test here. You have to wait until the music starts, and then we're off to the races. There you go. Thank you.
Okay, great. Thank you very much, Steve. So people just coming in, we have lots of seats at the front, so that's great. Okay, so Jennifer, I'll invite you.